Case study, CMT disease symptoms and progression. Introduction. Charcot-Marie-Tooth, CMT, disease, also known as hereditary motor and sensory neuropathy, HMSN, is a group of inherited neurological disorders affecting the peripheral nerves. It's estimated that CMT affects about 1 in 2,500 people in the United States, making it one of the most commonly inherited neurological disorders. Clinical presentation. The patient presented with classic CMT disease symptoms such as muscle weakness in the feet and lower legs, sensory abnormalities like numbness and tingling, muscle atrophy, and foot deformities including high arches. Reflexes were found to be diminished. Diagnosis and progression. A diagnosis of CMT is often confirmed through genetic testing and nerve conduction studies. In this case, the patient's symptoms had been progressing slowly over a span of several years, which is consistent with typical CMT disease progression. It's important to note that the rate of progression can vary widely even among affected family members. Statistics. According to the Charcot-Marie-Tooth Association, around 75% of individuals with CMT experience foot drop, and over 35% report muscle atrophy as one of the initial CMT disease symptoms. Approximately 60% of CMT patients experience sensory abnormalities. Facts. CMT is actually a group of disorders and is categorized into different types, each with distinct genetic origins and symptoms. CMT is named after Jean-Martin Charcot, Pierre-Marie, and Howard Henry Tooth, who first described the condition. The disease usually manifests in the first or second decade of life, although it can appear at any age. There is currently no cure for CMT, but physical therapy and assistive devices can help manage symptoms. Surgical interventions like tendon transfers or osteotomies may be considered for severe foot deformities in CMT patients. Conclusion. CMT disease symptoms and progression can vary greatly among individuals but generally include muscle weakness, sensory loss, muscle atrophy, and foot deformities. Ongoing monitoring is essential for managing symptoms and improving quality of life. For more information, for a deeper understanding of CMT disease symptoms and progression, consult medical literature and healthcare providers specializing in neurological disorders.